The following segment is sponsored by Oakview-Medical-Associates.
Welcome back. Before finally falling to sleep at night, do you lay in bed thinking about your to-do list, something happening at work, or even social interactions you wish had played out differently? You're certainly not alone. Dr. Nita Bashur from Oakview Medical Associates is here to discuss stress management along with licensed massage therapist Sarah Ratliff. Good morning to you both.
Good morning. Hey, good morning.
First, Dr. Nita, we know lifestyle medicine integrates elements like clean eating, regular physical activity, quality sleep, and stress management for good health. So how important is stress management?
So stress actually is defined as physical or emotional factors, internal or external, that we perceive as a threat to our system. And what that does is it manifests in certain bodily or emotional tension. And most of us manifest the stress as pain or headache or anxiety. So stress is really important because it impacts health. Stress can cause sleep disturbance, it can cause anxiety, it can cause heart disease, believe it or not, diabetes, weight gain. And in 2016, the study showed that 71% of our population has at least one symptom from stress.
And I imagine daytime stress in some ways keeps us on our toes, keeps us alive, but nighttime, that is when it's the most important time to get rid of that stress.
Yes.
Why is that? What do we do?
Nighttime, or when we sleep, our body's defense mechanisms are supposed to be at rest. Mm-hmm. At that time, if we are activated or have racing thoughts and have thoughts of anxiety and fear and what if we're living in the past or tomorrow, then that disturbs our chemical system when we sleep, and that activates a lot of hormones that do not need to be activated at that time, and that keeps the blood vessel tension high, which then causes heart rate to go up, blood pressure to go up. So it's really important to get good restorative sleep.
All right, what are those tips then? What do we need to be doing at night to wind down?
I think when you get ready to go to bed, having a very quick, simple routine. It could be just taking a shower, brushing your teeth, listening to some soft music, keeping the electronics away. Also just breathing. When you lay in bed, I call it my simple 7-11 routine. I teach all my patients this, is take in 7 breaths and exhale 11 breaths. Okay, and what that does is our body, actually, when we breathe on a daily basis, we don't use 40% of our lung space, if you can tell. When we breathe out, we're like, we could go even further. So that's the space we want to really clear up and then oxygenate. And that, in turn, will help our system tremendously.
So fill up those lungs,
Yes.
empty them completely, and do that with some thoughtfulness, some mindfulness.
Mindfulness, yes.
Sarah, with 17 years massage experience, you're the lead clinical massage therapist and lifestyle medicine coordinator. Talk to us about the benefits of massage from a health perspective.
It just keeps your whole body healthy. Getting massage on a regular basis, at least once a month. I recommend every 2 weeks. Decreases tension in your whole entire body. You can sleep better if you get massage. And it's just an all-over great thing to do. I just recommend people, it's not just a luxury. You need to get massages.
I love that. And that happens right at Oakview Medical.
Yeah, so most people don't know, but massage therapy is not just for relaxation or spa-like feel. That's essential, but it's used in cancer patients that are in remission or about to go in for treatments. It's also used in patients that have chronic pain, fibromyalgia,
MS,
multiple sclerosis,
Parkinson's
absolutely,
disease.
older patients that have Parkinson's disease, gait instability. All of these medical conditions benefit from massage, and that's not the very well-known aspect of massage because insurance companies unfortunately do not cover it many of the time. So we really try to incorporate it. It's coming.
Change is coming. Yeah. And Sarah, I bet you just see people walk in feeling one way and walk out completely refreshed.
I do, and I
It's
love
a great
it.
thing.
I love doing it.
Well, and Dr. Nita, you're bringing back, by popular demand, something that's kind of neat. It's your weekly Body by Bashur lifestyle medicine group visits.
Yes.
Tell us about those shared appointments.
So shared medical appointments are actually covered by insurance. What it is that you sit with your doctor and a group of other patients that have a similar condition they're dealing with, and we talk about education, empowerment, the different things you can do in your lifestyle to help address that disease. And, besides having a good, well-balanced diet, having positive social connections, really being mindful and being self-aware, I think that's the key to managing stress. We cannot eliminate stress. Stress is basically all around us every moment of the day, how someone speaks to us, how someone acts with us. It's what we take in. And conserving our energy and being responsible towards ourselves, because we have to provide the best for our friends and family and at our workplace. And if we let every little thing get to us, then we're like pincushions and we are so reactive. Instead of being reactive, being proactive. That's what I've brought into our practice. And I told Sarah she needs to be in our practice, because even if I can't get a massage at my office, just knowing she's there relaxes me. I think that's really been fun having her.
I love being there. I do. Love it.
It's a great environment
It
there.
is,
Anything else you want
absolutely.
people to know about the practice in general?
So our practice is very patient-centered. I think we listen to our patients. A big part of our job is listening, understanding what's brought them to that illness, and then taking them from that illness to wellness and calming down. Nothing can be fixed if we're all upset and angry, and we see that a lot. We see patients coming in. I tell all my team members, we are here to serve. So we don't take that internally. We're there to help our patients, help them get better. There are medications to help with stress, and then there are a lot of non-medication therapies. So with the group appointments, next Thursday, actually, our group visit will be on embracing and healing from stress and how to awaken our consciousness. So that's our focus. It is an RSVP event, so we need people to sign up online on oakview-medical-associates.com. Contact us is the form, and then just enter the code Thursday RSVP, and we will get them in.
Great. And we look forward to having you back next week. Our focus will be breath awareness for health. To get in contact with Dr. Bajour, Oakview Medical Associates is located at 11 Five Forks Plaza Court in Simpsonville, and the number 627-0444, the number right there on your screen. So thanks so much for being here. I
you.
appreciate
Thank
it.
you.
Have a great day.
Thanks.
We'll send it back to you in the newsroom.